Welcome to ABG's Quick Reference. Let's get started. So when faced with abnormal laboratory values for ABGs, you need to ask 4 questions. First, is it respiratory or metabolic? Is it acidosis or alkalosis? Is there compensation or no compensation? And if there's compensation, is it partial or full? So first you want to look at the pH and as it relates to 7.4. Is it elevated or low? Then you're going to look at the PaCO2 and see how it relates to the value of 40. Keep in mind, both of these numbers are the dead center of the normal range for pH and PaCO2. So your mnemonic is Rome, or respiratory opposite, metabolic even. If the arrows are pointing opposite to one another, then it is respiratory. And if the arrows are pointing in the same direction, then it is metabolic. For example, if you have a pH of 7.5 and a PaCO2 of 50, those are both elevated. They're pointing in the same direction, so this is a metabolic condition. Looking at example number 2, the pH is 7.32 and the PaCO2 is 50, so those arrows are pointing in opposite directions, so this is a respiratory condition. Step 2, is it acidosis or alkalosis? So looking at your pH range, is it low as it relates to 7.4 or is it high as it relates to 7.4, making that an alkalotic state. So in this case, looking at your pH, it is elevated. So this is metabolic alkalosis. All right, step 3, compensation. Compensation is the state where one system of the body is trying to cope with a problem and is having a tough time, so another system will begin to help. So you're always looking at the opposite system to see if there's compensation. So if it's a respiratory condition, then you're looking at the bicarbonate. So bicarbonate normal range is 22 to 26. So is that bicarbonate value up, down, or within range? If it's in normal range, looking at that NO on normal, then there is no compensation. If it's up or down, then there's compensation. So in this case, our bicarbonate is 21 and the normal range is 22 to 26. So that is not within range. So it's respiratory acidosis with compensation. And vice versa. If it's metabolic, look at the PaCO2. So PaCO2 normal range is 35 to 45. So if it's normal, no compensation. If it's high or low, then we have compensation. So looking at our example, our PaCO2 is 50. So it is metabolic alkalosis with compensation. All right, so is it partial or full compensation? So our normal range for pH, as we said earlier, was 7.35 to 7.45. So if it's outside this range, there is partial compensation. If it's inside the range, that means the body is able to compensate and that pH is within an acceptable range. We still need to correct the problem, but the body is coping at that moment. So in this case, the pH is 7.5. There is partial compensation. This patient is going to deteriorate a little more quickly than the one if the pH was within normal range. So what can cause these states? I've given you a few examples of differential diagnosis. So with respiratory acidosis, the patient is not ventilating enough. And I've given you a couple of examples there. With respiratory alkalosis, they're blowing off that CO2. They're ventilating too much. So they're losing the acid and they are accumulating too much base. So I've given you a couple of examples there as well. Looking at metabolic acidosis, that's an inability to excrete acid or lose the base. So diarrhea, for example, the stool is an alkalotic substance in the body. If you're losing too much of it, the acid is increasing in the gut and the base is being lost. So that will cause an acidosis. And there's several other examples there. Also with metabolic alkalosis, the exact opposite, loss of acid or gain of too much base. So for instance, with vomiting or NG suctioning. The patient is losing the stomach acid and therefore the base is becoming too elevated for that environment and it is causing an alkalotic state. All right, so the next PowerPoint has some practice problems for you to try. Good luck.